The overall goal of this procedure is to obtain the left atrial volume and the pulmonary artery diameter. The following instructions are based on the mouse's orientation. Every view should be adjusted where the dimensions show their largest extension. The left atrial and pulmonary artery will be assessed using a 710 25 MHz and 707 30 MHz probe respectively. Left atrial volume will be assessed obtaining three dimensions: the superior inferior, the anterior posterior, and the medial lateral. The mouse is placed in a supine position and the table is tilted 45 degrees towards the right side. The probe should be positioned at a 15 to 30 degree angle with respect to the table. To obtain the pulmonary diameter, the 25 MHz probe is switched for the 30 MHz one. The table is switched to a 60 degree elevation as if the mouse was in a standing up position. Then the table is slightly rotated 5 degrees towards the right side. The probe should be maintained in a short axis view orientation. In the long axis view, a movie clip is obtained to measure the superior inferior dimension, which will be shown afterwards. Next, the M-mode tool is used to get the anterior posterior dimension. Make sure to place the M-mode dotted line at the site of insertion of the mitral valve. Next, the probe is rotated 90 degrees. The view is then positioned at the side of the interatrial septum, where the left atrium is at the largest dimension. A movie clip is recorded to obtain the medial lateral dimension. The view should be focused on the pulmonary artery, where the bifurcation can be visualized longest. A movie clip is recorded for analysis. The probe should be slightly adjusted in the short axis dimension to obtain this view. To obtain reliable and constant measurements, the mechanical phases should be matched with the electrical component of the cardiac cycle. Each of the dimensions should be measured 3 times and their averages calculated. Please note that all of the left atrial dimensions will be measured at the end atrial diastolic phase, while the pulmonary artery will be obtained in between the end of the protosystolic phase and the beginning of the mid-systolic phase. The superior inferior dimension will be measured using the recording of the left atrium in the long axis view. First, the end diastolic left atrial phase should be found, as it's shown over here, which matches with the P wave. Then, the dimension should be measured from the vertex of the left atrium all the way towards its base. This should be done following the orientation of the left ventricle and the aorta, as shown here. Using the recording of the short axis view of the heart, the medial lateral dimension is measured from the most posterior portion of the interatrial septum, as it's shown here, to the most lateral portion of the left atrium in a diagonal fashion. To obtain this, please follow the contour of the endocardium, as it's shown here. The left atrial volume is calculated by using the ellipse formula, as shown below. For the pulmonary artery, using the movie clip, the diameter is measured at the level of a bifurcation, as it's shown here. Remember that the bifurcation of the pulmonary artery should be measured at the end of the ventricular protosystolic phase and the beginning of the mid-systolic phase, as it is shown here. The M mode is used to assess the anterior-posterior dimension, and is measured from the insertion of the valve to the endocardium, as it is shown in the dotted line. This should be matched with the P wave, as it is shown in the lower ECG.